This is the second day of our Lyme Mind conference, and I know it's a little early. Many people are coming from California, and it's also hard to get down to downtown Manhattan, so thank you. Thank you for taking the trip. My name is Savi. I'm the Director of Operations for the Institute for Next Generation Healthcare. I work closely with Joel Dudley, and INGH, Institute for Next Generation Healthcare, is kind of a mouthful, but INGH is a diverse team of data scientists, biomedical informaticists, software developers, geneticists, clinical researchers, and basically we're a group of tech nerds. And we are a research institute at Mount Sinai. We have an office based in Silicon Valley. We have a floor in an office building in Midtown East. And we have a brand new prototype clinic in the medical school library. We became an institute 3 years ago, and we formed under the vision, what will healthcare look like in 2025, and what can we do to bring that into practice today? And even though 3 years ago is not that long ago, 2025 doesn't seem that far away. And so we're trying our best to accelerate this future vision. And we imagined what it would look like, what healthcare would look like a decade down the road when we started. And we started with this blank slate and this utopian future. And imagining this perfect universe, we said to ourselves, well, healthcare should be driven by data, enabled by technology. It should be personalized. It should be predictive. There should be equal attention to health and wellness as well as disease. It should be scalable. It should be democratized, and it should be with patients at the center. Patient-centered healthcare is not a new idea in healthcare, actually. It's the force behind a lot of innovation that's happening in hospitals and healthcare systems around the country. But for INGH, the patient-centered future is one that is driven by the individual's ownership of their data, the individual's ownership of their autonomy, and the individual's adoption of this new model, whatever that happens to be. The future of healthcare will come and is coming. We see it every day. And it's coming because patients are raising their voices to be heard. And nowhere is that more evident and more transformational than in the Lyme disease community. When we look at the transformational force that patients in Lyme disease have made in the last 3 decades, it's remarkable. Because of their voice and their advocacy, because of their passion, research has been funded. Because of their passion, understanding has been accelerated. Disparate research communities have come together, and we are advancing discovery every day. It is because of the brave patients of the Lyme disease community that we are all here today. This is our 3rd year hosting the Lyme Disease in the Era of Precision Medicine Conference. And I'm going to start, before I explain what today is going to be, I want to start and talk about a few logistics. Just like yesterday, for those of you who are here, we're going to be doing questions and answers via text message. And you'll have to forgive us, we are tech nerds after all. And I think that everyone yesterday, it was a very enjoyable platform, and I hope that we continue to exploit that technology today. There are phone numbers and cards on the tables with the information. The information will also be projected on the slides. We will be doing this also for the 2 panels that are this afternoon. We have an exciting panel led by Ben Nemzer, the Connecting Communities Patient Partnership panel. And we also have a panel this afternoon that's moderated by David Roth, the Outreach, Advocacy, and Building Momentum for Change panel. Later this morning, when we break after questions and answers, we're going to have a Lyme Mind Expo out in the lobby. And you'll see different tables and different groups set up displaying advances in research and development. The advocacy groups are going to be out there. Bay Area Lyme Foundation and Limelight and the Biobank all have tables set out. We also have a Lyme Mind Stories Experience booth. And this is near and dear to my heart. We built this experience for this conference specifically. And it is in commitment to our desire to understand and collect the shared experiences of the entire community. I hope you will check it out. It is an interview booth for patients, for the caregivers and families, for researchers and clinicians, and we are asking you to share your story with us. So please, during the break or during any time today, please go and check out that experience. We will also, during the Expo, we will have 2 breakout sessions. One, Living Well with Lyme, The Power of Nutrition. That'll be led by Vicki Koblener and Dr. Saruchi Chandra. They'll be talking about individualized diets and nutrition models for dealing with chronic Lyme disease. We will also have a breakout discussion led by Jason Bobe and Ryan Viglizio, the N of 1 trials, patients with chronic Lyme disease, a participatory design workshop. This is a very exciting experience, getting to design trials, individual N of 1 trials, just for individual patients. So we're asking you to tell us as a community what is needed. And Dr. Brian Fallon will be giving a talk this afternoon between our 2 panel discussions, so please stick around for that as well. And before I announce our first speaker of the day, I'd like to do a little practice that's near and dear to my heart. I'd like to introduce gratitude. And I know this is unusual for a scientific event, so please forgive me. But I want to first state by saying that I am grateful to you all for being here today and for yesterday. I am grateful to all of those who gave their time and energy helping me in the earliest planning stages of this event. I know many of you had conversations with me, and I'm very, very grateful. Your thoughts and your input helped me bring this event into focus, and thank you. I'm grateful to my staff who have spent the weeks, the weekends, the nights, and the days working to put this together. I couldn't have done it without you. Thank you. I am grateful to the researchers, the clinicians, the physicians who have dedicated their lives to understanding, to helping, and for healing. I'm grateful to the patients who've made their voices heard. And I'm grateful for the Cohens, and especially for Alex Cohen for being so brave and for bringing together this amazing community of people. It's been said many times throughout the last 2 days, but the generosity expressed by the Cohen Tick-Borne Disease Initiative is truly transformational and has really laid the landscape for a lot of the newest understanding of this complex disease. So thank you again sincerely for being with me today and for sharing this journey. I will hand the mic over to Dr. Saruchi Chandra. She is our keynote speaker for the day. Dr. Chandra is a board-certified psychiatrist who specializes in integrative and holistic approaches for challenging emotional, behavioral, and medical conditions. So thank you. You should just be able to advance.